Hi, my name is Jessica Valdez, and I'm your employee benefits consultant for the 2021 to the 2022 plan year. So we're going to go over some of the changes that we put in place for your benefits. So let's share. So I work with financial designs. One thing I always want to remind you is the services that we provide for you guys to help make sure that the insurance is working the way that it should. If you ever have an issue with a medication, you ever get a bill that's incorrect, they're giving you an issue with a gap, you need help with a prior authorization, please utilize our claims team. We're here to make sure that we can assist you and advocate on your behalf when it comes to your benefits. So our office hours are 8 to 5 p.m. You could give us a call, or if you rather just email over, you could email claims@fdnational.com. You could send the bill and they'll work with the provider and the insurance to make sure everything is processed the way that it should be. So let's jump into the benefits. So this year we are switching from Aetna to AvMed, and we're going to have 3 different plan options. The first one is a base plan, the second one is a buy-up, and the third one is a national POS plan. I would only suggest going on the national plan if you feel like you're going to have to be seeing doctors in another state. So if you are on the base plan, let's say, and the network is just Florida based, but you have an accident in Colorado and you're skiing, for any accidents that you have to go to the emergency room, you're able to go to an emergency room nationwide, and that's covered as in network. So once again, I just want to reiterate the nationwide plan is just if you want to see a doctor in another state and you want to have that flexibility, then you would upgrade to that plan. So let's jump into the base plan. So your base plan, you have a PCP copayment of $30 and a specialist copayment of $60. If you're going for an annual visit, that would be $0 if you're going for your preventative. Virtual visits are $0. We strongly recommend utilizing virtual visits. Number one, there's no cost. It saves a lot of time. You could do it from the comfort of your home, and they could prescribe you through the phone. Minute Clinic is $30. There are 2 things that the GAP doesn't cover. The GAP doesn't cover doctor co-payments, which PCP, specialist, virtual, Minute Clinic are all considered doctor co-payments, and medications. So, however, if you have to have a treatment done in the doctor's office and they apply it to your deductible, it will cover that. So, for example, let's say I go to a specialist, I have to pay $60 to see the specialist. In the specialist office, they say I have to do a biopsy, and it applies to my deductible. My GAP would cover the treatment done in the doctor's office, but will not cover the $60 copayment. So we're going to get into what the GAP covers. The GAP, it's like having 2 gift cards. This first amount that you see here, 5,000, 6,000, 8,000, is your first gift card for if you sleep in the hospital. The second number you see, 2,500, 6,000, or 8,000, that is for outpatient benefits. So we're going to go over the second gift card, which is outpatient benefits. Your ER applies your $6,000 deductible. If your visit is, let's say, 3,000 and you pick GAP number 1, you're going to have to pay the difference between the 3,000 and the 2,500, which would be $500. You'd be out of pocket. If you want to ensure that, you pay almost nothing, then I would recommend this 8,000, because your out of pocket is 8,100. What does that mean? That's the most you could pay in a calendar year. Once you pay 8,100, AvMed says you don't have to pay $1 towards any services. So if you have $8,000 for your outpatient benefits, so for your ER, your urgent care, if you sleep in the hospital, outpatient surgery, minor diagnostics, and major diagnostics, in the worst case scenario, you pay the difference of $8,000 and $8,100, which is $100. You sleep in the hospital with this $8,000, the most you're going to pay is $100. Now, let's go to this mid-gap. The mid-gap covers your deductible. So if you go to the ER, you're responsible for the first $6,000, and then the insurance will pay 50% up to $8,100. ER visits are usually between $3,000 to $4,000. So if you have $6,000, that'll cover your first ER visit. Your urgent care is $50. So 25 with all gaps, you'd be fine with urgent care visits. Inpatient hospital stay, like I mentioned, with this one, you'll get up to $5,000. The difference between $8,100 and $5,000, you'd be out of pocket $3,100 if you sleep in the hospital. With this plan, your deductible is covered and you pay a difference of $8,100 and $6,000, so it's $2,100. With this one, like I mentioned, this is the most extensive gap where you only pay $100. For outpatient surgery, it applies it towards your $6,000 deductible. Outpatient surgeries, depending on what you have done and where you have done, can range between $4,000 to $5,000. So With this one, let's say it's $5,000 your surgery, you only have $2,500 that'll be covered. With this plan, however, you'd have $6,000, so you'd be covered 100%. With the $8,000, you'd be covered 100%. Labs, blood work there's no cost. X-rays apply to the deductible. You'd have $2,500 to use towards X-rays, $6,000 or $8,000 depending on what gap you get. And major diagnostics applies towards your deductible, and you have 50% co-insurance. Major diagnostics range between $300 to $500, and all of the gap cases you'd be covered. So you want to think to yourself, how much gap do I want to get? How much coverage do I want? With gap number one, you have $5,000 if you sleep in the hospital. You have $2,500 for all your outpatient benefits. So if you're okay with that because you haven't really used your benefits, that's fine. I just want to let you know that you could have a possible exposure of the difference between $8,100 and $2,500. Although it's highly likely you'd have to have an ER visit and an outpatient surgery. With this mid gap, you have $6,000. That'll at least cover your deductible. And then your responsibility in the worst case scenario is the difference between $8,100 and $6,000. And then if you really want to gap it and you'd rather not pay anything for any outpatient or inpatient hospitalization besides $100, then I would recommend going with this richer gap. Okay. Like I mentioned, gaps don't cover medications. With this AvMed plan, your medications are up to $15 for generics, up to $25 for preferred brand, up to $40 for non-preferred, and up to $80 for specialists. So let's go to our next plan. So the buy-up plan, your PCP copay is $25, so a little bit less than the base plan, and your specialist is $50. Virtual visits are $0. Minute clinic is $25. Those four aren't covered by the gap. Then you have an ER copayment of $500. So as mentioned before, in the previous plan, it applies to the deductible. Here, it's just a flat copayment of $500. For your urgent care, you have a flat copayment of $75. If you sleep in the hospital, you have to meet your $3,500 deductible and then your $1,000 copay. So you're looking at $4,500 if you sleep in the hospital. For outpatient surgery, it applies your $3,500 deductible and then a $500 copayment. So in the worst case scenario, you're looking at $4,000. Labs are covered, X-rays are $75, and MRIs are $200. Considering that these are all flat copayments, you know what to expect. It's not applying it to the deductible. The $5,000, $2,500 is okay if you don't have to do a bunch of diagnostics or you don't have a pending outpatient surgery, because you have $2,500 to cover your copays of $500, $75, and $200. The only most exposure would be if you have an outpatient surgery, you only have $2,500, so you'd pay the difference. You pay that extra $1,500. If you want to make sure you don't have to pay that difference, then you can come up next to this $6,000, which will cover the outpatient surgery 100%. It'll cover your inpatient hospitalization 100%. With this buy-up plan, I only recommend getting the $525 and the $6,000, because if you sleep in the hospital, the most you're going to pay is $3,500 deductible, then $1,000. So you'll pay $4,500. If you have to go into the hospital again, let's say you already met your deductible, so you just have to pay $1,000. So with this buy-up, it would cover 2 hospitalization stays, which are highly unlikely throughout the year. And these are all pretty low co-payments. So we'll definitely cover your outpatient surgery, which is $4,000, and all these other outpatient benefits that you may have. So I just want to reiterate, I think the $8,000 is a little bit excessive. I'd stay between these two. The last plan is the AvMed, and this has the same drug card as I mentioned before. I want to point out that Walgreens is not in network with AvMed. So you'd have to go to CVS, Publix, Target. If you take medication often, I recommend going to Publix. They have the lowest copays. So they charge way less than CVS. Now the national plan, like I mentioned, this is so you could have a network nationwide. I just want to reiterate again, if you travel and you have an accident, you will be covered for anything that is accidental or life-threatening, like a broken bone, shortness of breath, anything like that. So the AvMed National Plan, you have $25 PCP, $50 for your specialist. Virtual visits, $0. Minute Clinic, $25. For your ER, you just have a copayment of $350. For your urgent care, you have a copayment of $75. If you sleep in the hospital, you have your $2,500 deductible. So once you've met $2,500, the insurance will cover 90% of the cost up to $6,500. Hospitalizations can be pricey, but this is a little lower co-insurance. But if you want to make sure that regardless of the hospitalization, you're mostly covered if you sleep in the hospital, you probably want to get this 6,000 because your out of pocket is 6,500. So in the worst case scenario, if your bill is $100,000, you just have to pay 2,500 and 10% up to you reach the 6,500. Then AvMed assumes all costs. You get $6,000 from the gap. The most you would pay in that inpatient hospitalization would be $500. Your outpatient surgery applies your $2,500 deductible and then 10% after. So this base plan would cover your deductible, and then you just be responsible of 10% of the outstanding balance. So if your surgery is $4,000, you pay the first 20. The gap will cover the first 2,500, and then you'll be responsible for that 10% up to 4,000. Labs are $0. X-rays are $50. Major diagnostics are $200 if done at an independent facility, and $400 after your $2,500 deductible if done at the hospital. I think if you want to make sure that you're got the most adequately, I would recommend going with this 6,000. If you choose to go with the 5,000, 2,500, you will have some exposure if you sleep in the hospital. That's between 5,000 and 6,500, and you'll have some exposure if you have an outpatient surgery. Okay. So those are the new the new AvMed benefits. I do also want to point out the national plan is a POS. So you do have out-of-network benefits. You have a $7,000 deductible if you sleep in the hospital. And then you have an out-of-pocket. Give me 1 second. I don't know why it's not going away here. Sorry. And then you have your out-of-pocket of $19,500. So if you need to go see a doctor that doesn't take any insurance, you're responsible for the first $7,500, and then the insurance will cover 40% up to $19,500. You want to make sure you stay in the network, because when you stay in the network, you're bonded by contracted rates, meaning the doctors can't charge you more than what is ordinary. If you have any questions after this, we're going to have a Q&A on Friday at 10:30 a.m., or you could feel free to give myself or Dada a call here at the office. Thank you very much and have a great day.